Hey team, Gerardo here, emergency veterinarian and one of the hospital directors at the Animal Emergency Service. I hope you're all safe and well. I've been asked to jump on and put together a little video about what we are doing for COVID-19 in our hospitals. First of all, a bit of a disclaimer. This is, as I said, what we are doing for COVID-19 at our hospitals. It's not to say this is what you need to do. So watch the video. If there's any insights or anything that some takeaways for you, then please do. But if you've got some solutions that are better than the ones that we've generated, then please use yours. So if you want a more detailed description about what we're covering here, then you can head to our Vetapedia webpage. So it's www.vetapedia, so vetapedia.com.au. So let's get cracking. First of all, a bit of background info on COVID-19, just in case you haven't heard this before. It's a highly infectious virus, very similar to like the flu. It can show flu-ish like symptoms, and some tricky things about it. One is that you can actually be shedding the virus and actually have no symptoms, and there have been cases of humans who actually have had the virus the whole entire time and not shed at all. And this is particularly in younger people. You can also shed the virus for 24 days at this stage. So the information I'm sharing with you now is as of up to date as possible. So in 2 weeks time, if you watch this video, then it might be changed. But the transmission of the virus is primarily through droplets from the carrier. So droplets through sneezing or coughing, or those droplets being transferred onto surfaces and you touching them and wiping your face or mouth with them as well. So direct transmission through droplets to you, or from them onto a surface and then you touching the surface. So the highest risk is actually direct transmission of respiratory droplets through coughing and sneezing on you. Lower risk is actually, as I said, touching surfaces and then which are directly contaminated and then touching yourself. So the way I look at this, and I put this into perspective, is there is this big concern in our hospitals about our exposure to COVID-19, especially the risk of patients coming in. So patients who come from COVID positive households and the risk behind there, but most of the risk associated with our interactions with clients and so forth is actually through direct contact with the client. So if you haven't progressed to some kind of social distancing in your practice, we are progressing to what we call virtual or phone consults. So I don't like the idea of client-free or no clients in the hospital. I think virtual or phone consults is a good way to track to. But I want you to consider, I suppose, the people who are kind of at the front line. So this is medical staff in the hospitals, or even the staff of Woolies. Okay, they are dealing with hundreds of people who could be shedding the virus without them knowing every day, but they're on the front line scanning food items and so forth. So we have to put that into perspective. Those people are not wearing PPE. Okay, so, and I will talk a little bit more about PPE later, but they're touching surfaces that someone's touched and scanning and putting it on. So social distancing is most important, and personal hygiene is really important as well, especially hand hygiene. So all I'm asking here and why I'm sharing that is just to make sure that you're balancing it. You're balancing your risk of exposure and the measures you're putting in place to try to reduce risk. So, and try not to go too far, especially when PPE and medical equipment and medical supplies are actually of high demand in human hospitals, or will soon be. The other thing is that we could implement all these strategies in the hospital to reduce risk, but then if you're not being socially responsible and going to a secret barbecue at your friend's place or something like that, then what you're doing is actually negating the efforts that other people in your practice might be doing to reduce the risk of bringing COVID-19 into the hospital, or reducing COVID-19 coming to hospital coming in through client interactions. So let's play our part. It's a real risk, I understand, but we need to mitigate it. We need to reduce it in an appropriate manner. So first of all, let's cover disinfection. So the virus can be killed by various hospital grade disinfectants and also household disinfectants as well. but it all depends on contact time, and also it depends on the efficacy depends on the degree of organic matter that is with the actual virus. So if we're talking about mucus spray, or hopefully not snot droplets or something, right? There's some disinfectants are not as effective if the virus is still within kind of organic matter. So we'll go through a few of them now, and we'll put some notes up on the board here as well. And also, as I said before, you can go to www.vetipedia.com.au for this in more detail. So first of all, we'll cover accelerated hydrogen peroxide. So this is things like Virkon S, Oxivir or Intervention, or there's probably different brands out there. So we're talking a concentration of 1 in 100. It needs a contact time of somewhere between 1 to 5 minutes. There is some evidence to suggest that actually it's 1 minute, but I don't believe it's actually been, at least Virkon S has been specifically tested, and the data is somewhat extrapolated from the contact with or the use of these products with SARS. So it's highly effective. The next agent we're going to cover is bleach. Okay, you probably have bleach in the hospital, even at home. You're going to make it to 1 in 50, which equals 0.1%. And at that concentration, it needs 1 minute contact time. But it's only stable for 24 hours, so you can't make a big batch. It will last you a week. You need to make it on a daily basis. So to make a 4% bleach down to 0.1%, then you add 12.5 mils to 475 mils of water, or 25 mils of 4% bleach to 975 mils of water. It's good for hard surfaces, so I wouldn't suggest you spraying bleach everywhere. I can use your common sense. It's not going to be great stuff to spray everywhere, but it's good for hard surfaces that can actually be cleaned quite vigorously. So cages, I suppose, just as long as a patient's not going to go in immediately in thereafter, but surfaces, maybe floors as well like that, and it's highly effective as well. Next agent is hydrogen peroxide. So we're talking about a 0.5% concentration, and it needs 1 to 5 minute contact time as well. Some evidence suggests that actually 1 minute is enough for a kill. The next agent is quaternary ammonium compound. So this is F10, and the data here is not as solid because I don't believe it's actually been tested specifically against COVID-19. But the concentrations they're talking about is 1 in 250, and the contact time is 10 minutes, where if it was 1 in 100, then the contact time would be 5 minutes. It is effective, but not as effective as the ones we've covered just previously. The next agent is alcohols, and what I'm referring to here is solutions or products which have greater than 60% ethanol or greater than 70% isopropanol. It needs 20 seconds of contact time. This stuff dries pretty quick, so it's useful in sprays or wipes for equipment which really can't handle moisture. So computer keyboards or screens, phones, things like that, just be careful. So you can use those that kind of agent for those sensitive equipment, and it is effective. And by far though, the most important thing is hand washing. It's everywhere. The government's released handouts on how to wash your hands properly. So hand washing doesn't deactivate the virus, it actually washes the virus off. So the recommendation is warm water. The virus has been shown to be inactive or deactivated at 56 degrees. I'm not saying put your hands in 56 degrees water, but it shows that it is susceptible to heat. So warm water and soap for 20 seconds. So turn on a tap, warm water, get the soap and scrub. 20 seconds, 20 to 30 seconds, okay? It's a long time, longer than what you think. Then rinse and dry your hands. Try to avoid the contact with the taps. So maybe use a tap which doesn't require you to physically turn on and off. So if you have a knee tap in the surgery, then use that. Otherwise, with the paper towel that you use to dry your hand, because your hands should be clean by now, turn off the tap and then throw the paper away. Other things to consider is maybe moving towards bare below the elbows. So things like this, okay, that wouldn't be appropriate because it could contain virus particles or minimize the efficacy of your hand washing, so rings and watches and so forth. And because you're going to be washing your hands quite frequently in our hospital, what we've started to do is actually implement 30-minute hand washes. So we have timers, and also we have red arrows on our clocks, which actually show at the start of the hour, in the middle of the hour, we need to wash our hands. So bare below the elbows actually makes hand washing so much more easier. What about gloves? What about gloves? Well, actually, we don't need to wear gloves all the time. So gloves add an additional layer of protection, but hand hygiene is really important. So if you're going to wear gloves, because what you should do is actually wash your hands, then put your gloves on, and then after you take the gloves off, wash your hands again. Okay, so if you're going to implement strict hand hygiene protocol, then you would still wash your hands despite the fact you're using gloves. With regards to cleaning the environment, so I'm talking about the hospital environment here. So using hospital grade disinfectants and gloves, okay, and ideally gloves which are reusable. So your thick kind of dishwashing gloves, and still make sure that you implement strict hand hygiene before, after you clean, take the gloves off, and after, okay? So this is cleaning the hospital. You've got to think about the areas where you frequently touch or use the most, okay? And then implement protocols which then clean those areas routinely. So the high touch areas such as door handles, keyboards, countertops, computers, lab equipment, microscopes, ultrasound, x-rays, they're cleaned on a frequent basis. So maybe do it every couple hours, or at the end of a shift and before a shift, depending if you're a 24-hour hospital. Minimally touched surfaces, then we still recommend it, we still cleaning those minimally touched surfaces like walls, cupboards, and doors. We're doing those every 24 hours. So the other thing is to consider is maybe color coding and reusing cloths. So you can get microfiber cloths, and which you can wash and launder using hot water and an enzymatic laundry detergent. So if things which are not nice, like cleaning the toilet or something, or the taps around the toilet, okay, then you would probably highlight those cloths in red, so you know then they're not going to be used in the kitchen. In the kitchen you'd have green cloths, and around the hospital have blue cloths. And if it was an infectious area where maybe where a client's come in because of euthanasia and they wanted to be present, then maybe that consult room could be actually, or the front area of the clinic, yellow for infectious area. So red for toilet, green for kitchen, blue for general hospital, and yellow for infectious area. So that's the general that's the guidelines that human hospitals use. With regards to team, if you haven't started isolating your teams, then and you do have the capacity to do so, then consider doing that. A lot of hospitals around the world are doing that. We have multiple hospitals in Southeast Queensland, and we've isolated the hospitals. There's no staff moving across, and yes, it was an absolute pain in the behind, but we got through it and we did it. We also had teams within the hospitals, and we've also made the unreasonable request to our staff to not mix as teams outside socially. So they're doing things like virtual get-togethers, playing games nights on iPads over Zoom sessions and so forth. So think of ways for the teams to still be social but not actually be social. And then have the teams that come into the hospital clean when they get there, and then clean at the end. So then when the next team comes along, they clean when they get there, and they clean at the end as well. So that's what we're doing to try to minimize contamination between teams, and also just to make sure that the areas that are frequently touched are as clean as possible. The next part we're going to cover here is what are we doing for pets that come from a COVID positive household. It's up to you. What we are starting to trend towards and move towards is assuming that all pets come from COVID positive households. And the reason being is you could have asymptomatic or non-symptomatic carriers at home that are shedding virus and so forth. So if a pet comes down, they still could be in a household that is COVID positive. So one thing to recap again, there have been no transmissions from animal to human at this stage. So when I checked today, the world was sitting at 530,000 human to human cases of transmission. There's no record at this stage of there being animal to human. So the risk is minimal. So you've got to focus on trying to protect your staff and yourself, or minimize interactions from between you and the client. Okay, so not necessarily so much from the pet that you're trying to treat and yourself. But if you were going to implement some kind of protective measures, then PPE that you could consider to use may be something like non-sterile gloves, a gown or an apron, and masks. But to be honest, when you're assessing the degree of risk from a pet, okay, to you transmission is very low. We just need to throw in here again that there are human medical staff around the world that are in incredibly high risk situations, and I'm sure you've all seen images of them walking around wearing masks and face shields and things. It's because they need it, okay? But I've also seen images where medical staff are using gowns that have been reused and they're sticky taping and duct taping them together. So when we're talking about using PPE, we've got to be responsible with our usage of PPE. So what we're going to do is, if you are going to use some non-sterile gloves, then you can wash them in between uses. It's not like just one use, wash, throw away, okay? So if we're still going to be interacting with that client for a period of time, then you can actually wash the gloves. You can spray Virkon on them, or you can wash them just like as if you were actually washing your hands. With regards to gowns, you can experiment with your disposable used gowns. You can actually put them through the washing machine and then take them and then reuse them again. And we tested our disposable gowns that we use in our surgeries, and they actually come out the other end perfectly fine. So we are now collecting those, and we have the tubs of non-sterile used disposable gowns. With regards to masks, we are transitioning to material masks that can be washed and reused again, even material masks that you can also wash and then sterilize and then use again in surgeries. So the whole aim here is to reduce our consumption of PPE that could be used by someone who actually needs it more than what we do. What we are doing is adding some layer of protection for our staff so they feel safe having interactions with clients, but we have to balance that risk. So have a look at your protocols, your procedures, and see whether or not there is a way that actually you've gone too far. And can you pull it back a little bit? Or the PPE that you're using, could you reuse it? Is there a way you could wash it or use things that could be washed and sterilized? So the other thing we're doing is minimizing the amount of things that come with the pet. So leads and collars and harnesses, we leave those with the owners. And when they come down to the doorway, we actually put a trolley at the doorway. And I know it sounds like a barrier, but clients are holding pets, they're holding onto their cat carrier. They can put their pet or the carrier on the trolley. And it's really useful if the patient's sick and in a critical state, they can put their collapsed pet on the triage trolley, and then what happens is all we need to do is put a hand with a glove, right, or even a towel over the patient and take the trolley out to the back or to wherever you triage your patient. So the trolley there at the doorway for us serves a point of actually being useful as a place to put pets, and also at the same time it's a non-intrusive barrier just in case the client is not in a state and tries to walk through the door. So when the pet actually gets into the hospital, and what do we do with that pet there? There's a couple options, and one that was on an AVA guideline was, or a suggestion was potentially bathing the pet in warm soapy water. You could do that if the pet is stable. One thing that we're going to try is actually wiping down the pet in Virkon. And I know Virkon sounds terrible, but Virkon is also registered to be used in horses for the treatment of ringworm, where you actually douse the whole entire horse in Virkon. Virkon is used by Navy divers to clean their respiratory gear before they put it back in their mouth. It's actually quite a safe product, but be careful, and if you are going to wipe down, maybe consider some eye protection just so you don't get Virkon in your eyes. After we've done either a warm wash bath or Virkon wipe down, then the patients are considered as normal patients and then admitted to hospital as per normal. Then we clean any of the areas wherever the patient has been as per standard high contact cleaning protocols. As I mentioned before, we are progressing to virtual and phone consults, and what we've decided is that when the owner calls up, it's important that they actually understand, or at least get an indication of what to expect. So we listen and explain that we are here and we still want to be able to be of service and it's safe to come down. But also at the same time, when you come down, this is what to expect. And these are the things that we've implemented as to comply with social distancing and government regulations. Then we're also going to send them a text and an email, which has a list of those things as well, so they can read it if they're not the person that's driving, so they get a better indication, because they're not going to hear everything or have heard and comprehended everything you said on the phone. So some of the things we might put on there is that we are progressing to virtual phone consultations. Please give us a call when you arrive in the car park. If an emergency, give us a call just before you get here so one of our staff can meet you at the door. Pets are going to be admitted to the hospital, but we will ask you to wait in the car and then we'll give you a call. Hospital admission process forms will be emailed to you, so forth. So a list of things. At the hospital, we have a sign as well, but I would really consider to have minimal signage. Just the signage that is important, relevant right now. So have a look at your signage and just have key signage. When the client arrives, have staff there in your appropriate PPE, okay, and then follow as per whatever protocol you guys employ. So when the staff has donned their appropriate PPE and when the client's arrived, the staff member meets them at the door and the client then puts their pet on the triage trolley, and then what we're thinking of doing is handing a piece of paper, small piece of paper with instructions again, but a bit more detail about what's going to happen next. So they got information on the phone and text about what to do when they're coming down. Now this is information that's going to happen that outlines what's going to happen next. Then for us, we've created a website link, which the clients then fill out their details, which goes straight into our database, which helps us with putting and creating client records. But other practices have used things like SurveyMonkey or even a paper form, which then they take a photo of, and that's their admission paperwork, and they fill it out from the photo, which they can then convert to a PDF and attach to the record later. If the patient is assessed to be critical at the doorway, then the patient is brought out the back directly to the triage bench, and as part of the triage, we do a Virkon wipe down and make sure that we employ strict hand hygiene after triage. If not so critical, then the patient is taken to a consultation room where the vet will come in and then do the phone consult. Euthanasias are a bit trickier. We're still allowing clients to be with their pet, but limited to one person, or sometimes one person at a time, or we even do a video euthanasia as well. So our staff member is there wearing PPE and also employing social distancing just to reduce the risk from potential COVID exposure from the clients that come through the door. What I shared with you is the solutions that we've come up with and some information about how we are disinfecting our hospitals. And as I said, if you go to the Vetopedia webpage, you will get that in more detail, but we don't have it all figured out. This is not our concrete set in plan and me telling you how to do it. We're just sharing information and hopefully it helps. And I'm sure that some of you out there probably have better solutions for your problems or your particular clinic than what our solutions are. But we are facing the challenges all together, and change management is so important, but also balancing staff concerns and the use of resources balanced and assessed against the actual risk that our staff are exposed to. So it's a difficult situation, but try to keep that all in mind when you are developing protocols. I believe in sharing openly about the situation with staff, developing plans and then checking it against the real risk, making sure we haven't gone too far, then sharing it with the team and enrolling the team around it, and then evaluating the plan and adjusting it. So really being agile in this time is really important. We're also asking our clients what they thought about the solutions that we generated and the things that we've implemented. How can we improve it? Because we have to remember our clients are just as scared as us. They are concerned about getting COVID from us just as much as we are from them. But they also have to tackle with dealing with an ill pet in a time when they really don't need it, and potentially they are faced with financial insecurity as well. They may have lost their job. So we have to be open. We have to listen, be compassionate, demonstrate empathy, and really work together with them in times of need like this. The final thing is that we can implement all these protocols at our hospitals to reduce our risk, but we have to be just as vigilant at home and socially responsible. And the reason being is if you're not socially responsible outside of work, then it kind of negates the protective measures that people are trying to put in place in the hospital. I believe I am more at risk of getting COVID from being out and about and going shopping than actually getting it from a pet that is passed through a doorway. So just got to try to put things into perspective. But I hope this helps, and again, I appreciate VetPay for giving me the opportunity to share this. And again, if you want more information, you can head to our website, www.vetapedia.com.au.